Hey, welcome to another great edition of Mississippi Stories. I'm your host, Marshall Ramsey, editor-at-large at Mississippi Today. And of course, you can find all of our great coverage at MississippiToday.org. And you can even see some of my cartoons as well. I tell you what, I love doing Mississippi Stories because I get to meet some really interesting people and get to talk to them and find about the great work that they're doing here in Mississippi. And our guest today is no exception to that. It's Karen Matthews. She's the Chief Executive Officer and President of the Delta Health Alliance. Up in the Delta. I would imagine you're in Stoneville, Mississippi, which is the center of the research universe in Mississippi. Some good stuff going on up there. Anyway, the Delta Health Alliance is Delta's nonprofit network of hometown helpers that give better access to healthcare and education and family services. They've served Mississippi since 2001. I remember when that happened. I remember the editorial boards, and it seems like that was about 2 weeks ago, but it's been 20 years. And so, yeah, Karen, welcome.
It's been a long time. Thank you. Thank you, Marshall.
Yeah, I did all that in one breath too. So I just wanted to, I thought you'd be impressed. I know, it's one of those days. I hope you're having a good day today. Like I said, Stoneville's a pretty darn neat place. And I was trying to think, that was about the last in-person speech I gave was for the Leland Chamber of Commerce there in Stoneville. And it was literally the day before everything shut down.
Oh my goodness. Well, you were in the center of the universe right before everything shut down.
Exactly. So I do hope to get back up your way again soon. It is a nice part of the world, and the Delta is a magical and vexing place sometimes. And
it is definitely unique. I'm originally from Fulton, Mississippi, and so they called me a hillbilly for, I don't know, maybe 5 or 6 years, and then they kind of got used to me. So I've really enjoyed being in the Delta. They're wonderful people, but yes, lots of crazy stories, lots of
a lot of great stories, some really big mosquitoes that land at the airport, and but it's good stuff. Now, you said you're from Fulton, and you know, I was kind of looking back at your history and everything. You went to what, Itawamba Agricultural High School, is that it?
Yes. It's
yeah.
one of 4 agricultural high schools left in the state of Mississippi. And I think it just turned 100 years old.
Yeah, what's the difference between an agricultural high school and a regular high school? That just out of my stupidity.
I have no idea.
Okay. Good.
I really don't.
Yeah.
I don't know. I mean, I would assume it would be something like, you know, the land grant universities were created, maybe agricultural high school, but I don't know.
I figured there was probably a lot of 4-H thrown around and so forth too, as well, which I did 4-H, which was pretty cool back in the day. So you went into engineering originally. How does somebody going into engineering and then getting a master's in business end up in healthcare?
So I went into engineering because I was going to create, I think, maybe the first laptop. I was going to go to Silicon Valley, and
nice.
Steve Jobs kind of beat me to all the things that I wanted to do, you know, but I actually minored in accounting.
Wow.
Because I was the only girl in my engineering class. But I needed some kind of cool dates, and so I went over to the accounting school across the street and took some electives. I mean, seriously, that was probably the reason I did that. And I went to work for an accounting firm out of school because all the people offered me engineering jobs in the middle of the Cold War were kind of scary.
Yeah.
You know, I mean, it was like energy systems, and you had razor wire, and you know, all these places where I would go interview, and I was like, wow, that doesn't look like, you know, fun. So I took a job at an accounting firm, Ernst & Young, when I got out of school as a consultant, because I was one of the few people that could run a computer and all that sort of thing. And they said, well, what do you want to do? And I said, well, I want to do fun stuff like bond verifications and, you know, go to New York and all this, but don't put me in healthcare because I don't like the smell of hospitals, you know, all that. So I got up there in July, I'll never forget this, and they put me on the St. Jude audit. And I said, but you told me you weren't going to put me in healthcare. And they said, well, this is your first lesson, and get it in writing. And so I went to the St. Jude audit, and then I was in tears for like a week.
Yeah.
And I just started, as they put me in healthcare, I started thinking, how can technology improve healthcare? That just sort of, you know, kept coming up in my mind. And the University of Tennessee offered me a job. One of the audits that we did was the Regional Medical Center at Memphis and Methodist hospitals and all that. And they offered me a job a couple of years after I started. And I just got very interested in that component. And they told me, I just kept trying to move up that ladder and just decided to get my doctorate, in preventive medicine, and just got very interested. So we opened up a big telemedicine network across the state of Tennessee back then, and worked a lot with UMC at the time, to bring it down to Mississippi and work together. And that's really kind of how I got back down into Mississippi a little bit, is working with them with telemedicine and all that. So it's not what you ever think you're going to do, but I've used the engineering a lot, and very glad I did it. I'm biased. I think
Well, I'm still trying to wrap my head around, going to take accounting so that you can get dates. There are easier ways to get dates. I can tell you that.
Well, I mean, I just knew I was in a class with kind of, interesting characters. And I thought the guys over at the county still were cuter. So I thought, well, I'll go over there and take a few classes. And I just ended up, taking about 30 hours, I think.
Yeah. And I also know how hard everybody who's in accounting school works too. So they probably could never get time to go actually go do something. It's funny, like say you were right on the forefront of telehealth. And I remember when that was a big thing. And I remember people coming into the editorial boards and talking about that. And it's like, it really honestly didn't really hit hard until COVID came. And then suddenly everybody was doing telehealth. So you kind of had to sit there and think, yeah, well, I told you so.
Yeah, I mean, we listened to all sorts of reasons why telehealth wouldn't work and why it couldn't work. And back then it was difficult with the networks. There were no 5G networks back then.
Right.
It was very difficult. But it really, I thought that my main reason for it really helped rural America. It helped rural Tennessee. It helped rural Mississippi at the time, because people couldn't get off to get to a major medical center.
Right.
And it was really very helpful to those folks who had to decide, well, do I take a day off and lose a day's wage, or do I not go to the doctor?
Yeah.
And so I really have always been interested in sort of coming home and doing something. And that was kind of my way to kind of, I don't know, help people that grew up in places like Fulton. So I love telemedicine. I always thought it would work. But yes, I was the only bright light, I guess, in COVID that I can really think of is telemedicine has become pretty standard.
Well, that and Zoom, right? Because it's just so nice to be able to, Zoom is just so much fun. So, well, it's funny you mentioned that, because a really good friend of mine, a running partner of mine, and so forth, he's a cardiologist, and he said that where his patients have really liked it, you just nailed it, because like I said, they don't have to drive to Jackson to come to their appointment from the Delta or wherever. And he said that's been great as well. Okay, you've obviously, how many years have you been there now? I was trying to wrap my head around that.
Started July 26, 2006 at the
Wow. So that's gone by quick.
It's gone by really fast.
So what were you when you first started? I mean, what was your job?
Chief Operational Officer.
Yeah.
For DHA for a couple of years.
Okay, very good. And so I guess this is the point where we dive into DHA and talk about it a little bit. And I mean, obviously the mission. The Delta is obviously the land of need, especially when it comes to healthcare. And there's a lot of pre-existing conditions. I mean, that's why when COVID hit. And I think a lot of people were really nervous about what would happen in Mississippi, was because we have so many comorbidities here and so many challenges. And believe me, the Delta has been the epicenter really of a lot of, except for Issaquena, which is, I had like 3 cases, I think, in the last year and a half. I always marvel. I want to move to Issaquena because there's never any cases there, because like that's
far apart from each other.
Right, exactly. They have mastered social distancing as that.
Yes.
But talk about, when it was created, obviously Thad Cochran played a big role in it and getting the funding. God rest his soul. Talk about its original mission, how it's evolved, and where you're at today.
Well, it was really Senator Cochran's brainchild. I think he had done a lot for Mississippi and a lot for the Delta. And he became a little bit frustrated because he would do projects in Mississippi, fund some things in the Delta, and he would say, I really can't see the outcome of this. I can't see how this is doing any good.
Right.
And at the time I was at Tennessee, and and one of the things we did with the telemedicine network, and then when I was vice chancellor with a lot of other projects that we had, and I think this goes back to my engineering background, we measured everything we did.
Yeah.
You know, you don't do it. I mean, data is pretty much the world to me. I mean, you've got to collect it, you've got to make sure you collect it correctly, and you've got to analyze it. And so I think the fact that the way I sort of had always done things and the way we still do them at Delta Health Alliance is, if I tell my staff, if you don't write it down, if you don't measure it, you didn't do it.
Right.
You know, so I think as this was evolving as his brainchild, he was like, you know, if we can do succinct projects and actually do them, not really like a research project, because you're obviously serving people,
Right.
but to an extent have a research arm or an evaluation arm, I like to call it, because it's not like clinical research, you're not in a laboratory or anything. Then we will know if this works. And we got a lot of grief, because coming from like a you know, faculty type situation into Delta Health Alliance, of course, people are used to writing these great articles and you know, all these publications, all these educational publications. And we really don't do a lot of that at Delta Health Alliance. We do a little bit, but the reason we don't is we don't have 3 years to do a project, have a hypothesis, do a project, and then
Yeah.
see if it worked.
Right.
We have to continually evaluate that project to know if it's working. And if it's not, we have to change what we're doing so that we can get results with people. And so that's a little bit different than a lot of places do it. It's kind of this continuous feedback. We have accountability meetings every month, sometimes more than that, with every single of the 30. Right now we have 38 projects. We just got funded for another one. So I always
Wow.
have the wrong number, the wrong data. And when we do that, you know, we have these accountability meetings. They're not just us, but they're our partners in the community. Everybody that's involved gets around a table, and we figure out, what do we need to tweak, what's not working right, and bring the data back to the forefront. And that really helps people want to do projects, because it's not about, well, Marshall did this wrong or Karen did that wrong. It's, this is what the data are telling us. And
Right.
so we as a unit are going to modify our behavior based on this data. And it gives everybody sort of, I think, a really good feeling. And they seem to want to continue to do that. Plus, you know what you've done every day. I mean, at the end of the week, at the end of the day, you know, we collect data on everything.
Yeah, definitely on that. I mean, talk about that. Like I said, you've had 20 years, you've 38 projects. Good grief. You got to feel like the air traffic controller over at Atlanta Airport. You know, there's a lot of stuff going on.
There's a lot of stuff going on. We've got kind of this is our map. I printed this map out. I can show it to you. This is what Delta Health Alliance looks like right now.
Oh, wow. Oh, wow. Okay.
Yeah. I mean, like it's
So the Delta's grown a little bit.
Well, it's interesting. It started out with the 18 counties that were sort of the Delta.
Yeah.
And sometimes, especially Washington, might define the Delta a little bit differently. And so I remember one heart network, we really needed a heart program, you know, for heart patients. And they wanted to include sort of what we consider the North Delta, and then over into Marshall and Lafayette County. We were thinking, that's not the Delta, but you can't really tell the government, hey, you're wrong, because they just won't fund it.
Right.
So in order to serve Tate County, for example, or Bolivar County or Coahoma County, we also had to include Lafayette and Marshall, because that's what they funded. So that's why it looks kind of different.
That's why it's grown a little bit. That's why, like, let's say you grew up in the Appalachians, so go figure. So, right.
Right. No, we haven't
Exactly.
done anything in Fulton yet, but we're inching over that way.
I know, it's like you never notice. But looking back over the 20 years, what are some of the true success stories you feel like the Delta Health Alliance has had?
Well, I think we've made a huge inroad into teaching people in the Delta that they need to have a medical home.
Yeah.
To come back, you know, the behavior to come back to the doctor every 3 months or 6 months, or when you need to come back to, and I think that's also building trust in the system. When I first came, trusting physicians and nurses and people like that was way down on the poll that we did
Really?
of Delta residents. Yes. It was mama, preacher, and then you went on from there, and somewhere down that list was doctor, nurse.
Wow.
And of course, what we did is started doing a lot of home visiting,
Hmm.
got into people's homes, because you can talk to them on the phone, you can see them in a doctor's office, but until you get into somebody's home, you really don't know
Yeah.
what's going on. And so we hired a lot of people from the Delta. We trained them as community health workers and other outreach type workers, gave them certificates and training, and got them into people's homes. I think this month we've been into like 800 homes, even
Wow.
with COVID,
Yeah. Even with COVID.
for different projects. Some is
Right.
the heart project, the stroke project, the different projects that we have. But and so I think the trust in the health and the education system, we do a lot of educational projects. It was called Delta Health Alliance before Karen ever showed up. But in 2006, I said, look, you can't separate health and education,
Right.
because people are going to come into the doctor's offices and we're drawing suns and moons on medicine bottles to try to say whether to take it in the morning at night, because people can't read the bottles. So I think that combining health and education has been really important. Teaching people medical homes. I mean, we've just had a lot of really good successes. We've also started, we just got funded for the third Promise community. I don't know if you're familiar with what those are.
Yeah. I remember that when it was formed during the
When-
Obama administration, correct? Yeah.
Right. And it really tries to mimic Harlem Children's Zone, how
Yeah.
Harlem turned around as a community. And the premise is, if you can change the way that your children are educated and that your families think about education, then you can change the economics of a whole community. You can change, Harlem was a whole different place 20 years before the Harlem Children's Zone got started.
Yeah.
And the economics and everything about Harlem completely changed. And almost everybody that you read says that happened because of the Harlem Children's Zone.
Wow.
And creating a new generation of children from cradle to career, that were educated differently, that all of the supports around them were different. And so we first got funded in Indianola. Then we got another funding for Deer Creek, which was Hollandale, Leland, Arcola, that area. And just 2 days ago, we got funded for LaFleur County.
Oh, congratulations.
But in Indianola, our graduation rates are up from about 8 or 9% from what they were in the first 5 years ago.
That's incredible.
Yeah, kindergarten readiness has doubled.
Yeah.
Third grade reading is a whole lot better. I mean, like, I don't have the numbers in front of me, but tremendously better. And so I think that's been a huge success. And people say, well, why would that education have anything to do with health? But it's remarkable when you start thinking about, I tell people it's very important, because if you look at maternal health, we have a huge projects on maternal health. If children are born with the correct birth weight and they're not low birth weight, then they're going to be ready for kindergarten. And then they're going to read by third grade, and then they're not going to drop out of high school.
Mm-hmm.
And then we're not going to have as many prisons, because people look at third grade reading to decide how many prisons to build. So it has a huge impact. And then those students might actually graduate, and we might not have a lot of teen pregnancies, because part of the project's a teen pregnancy. So it's impossible to separate health and education. You're going to see early on how that child, if the child can see, if the child can hear, if the child's got a learning disability. In the Delta, before we started these projects, students got to be a lot of times into junior high, and they didn't have an individual plan for that student, and the student had a learning disability that wasn't diagnosed back when they were maybe in kindergarten or first grade. And I don't necessarily blame the school system. That's the reason you have Promise communities, because these school systems are struggling just to fill the classrooms with teachers. And so they can't even, if you can't even fill the classroom with teachers, then they're just struggling. And so it's really a combination of the school system, Delta Health Alliance, the community, the practitioners, the medical practitioners of the community, to build a promised neighborhood. Workforce development's a piece of it. It really is, diapers to diplomas, I like to call it, cradle to college. I mean, and it builds everything in with the community, and that has been a huge success.
Well, it sounds like the whole Ben Franklin thing, an ounce of prevention is cheaper than a pound of cure.
Oh, definitely.
Yeah.
Oh, most definitely. And getting that mindset changed in the Delta has taken a long time, but I think we're making some really good progress.
I mean, after 20 years, I mean, that's a generation. So, I mean,
Yes.
you should honestly be starting to see some things. And, you think about everything from diabetes to the food deserts that you have in the Delta, and there's all kinds of issues there that I'm sure y'all had to be in the middle of as well.
Yeah, we've had people tell us this won't work and that won't work, but we have community gardens all over the Delta, and
Yeah.
these students and the residents are taking care of them and learning to cook all these healthy things, and they're not letting the gardens, people said, oh, but people won't do that. People won't support that. But just think about students in 5th and 6th grade that don't have a lab. The community garden outside that school is their science lab.
Yeah.
And they love it. And so, yeah, there's a lot of different activities going on that sort of makes up.
Well, and we were talking earlier about telehealth, and I would imagine, I've driven through the Delta before, and suddenly my phone turned into a brick. I mean, when if there isn't 5G or there isn't, good cell coverage, for instance, and a lot of people, their phone is obviously going to be their computer.
Right.
So if they don't have it, so y'all been kind of in the middle of actually working on getting broadband into the Delta too, haven't you?
We have been in the middle of that, and not as successful as we had hoped we were, because when COVID hit, we immediately put out, I think, 1,800 hotspots.
Yeah.
One county, just immediately, because even if we could get students tablets, which we did, and the USDA, bless them, helped us so much, but we got tablets, but then they didn't even have access with their phones. So we had to get hotspots and, help really hotspots within the community, because the broadband still wasn't there.
Right. What, obviously when we've touched on Delta, yeah, Delta, the COVID Delta, but with COVID, when it hit, it seems like 15 million years ago, a year ago, March. How did y'all pivot? How did you change? What were some of the things that you had to change in the way that you did your services and everything to adapt? Because, I mean, obviously, just looking at the numbers over the last year, the Delta was hit hard. And that was one of the first areas in the state, to be honest with you, around Greenville, that was hit pretty hard. So what were some of the things that y'all did to be able to, because obviously you're in the middle of the health business. So what'd you do to help keep people safe from COVID?
Well, what a lot of the things that we did were, we are so heavily into home visiting and going
Yeah.
where the patient is.
Mm-hmm.
Our home visitors didn't miss a beat. We bought lawn chairs and fans, and they went and sat in people's front yards and talked to them. What can we do?
Oh, wow.
They were dragging scales and blood pressure cuffs around in their cars,
Mm-hmm.
just going literally from house to house. And then it got to be sort of a neighborhood thing. Instead of people coming to a cooking class or coming to a diabetes education class, you would have to have that sort of as a street party.
Yeah.
Out in the middle, and social distance, but people did it, and they still wanted that service. So we still kept going to the patients. We did a lot we could call it telemedicine, but we did a lot of video over the laptops, created the hotspots in the communities, and not only teaching, but just did tons of telemedicine. But we were already set up for that anyway. So we didn't have to really pivot much. We just did more of it, because our clinic that we have in Leland has several telemedicine offices anyway. And so we just did more of it. But we were already set up so much to do that in the first place.
You know, one of the things that y'all do is the Parents as Teachers program, which I thought, man, I wish I'd have had that actually before I had kids, because there's a lot of really good parts to that. Tell us why that's such an important program.
Well, we parent, at least I do, and I think almost everybody does. You probably do too, as we were parented.
Yeah, that's caused all kinds of problems for my kids.
But that's all we know.
Yeah, right, right.
And I open my mouth sometimes and I think, oh my goodness,
Oh yeah,
sounded like my mom,
yeah,
and I'm sure we all do that. And I said I was never going to do that. But for people that have grown up in a poverty situation or in a dire situation where they were not parented well, or maybe didn't know their parents, they have no basis. They don't know how to parent. And so Parents as Teachers is a curriculum that is a flexible curriculum where you start with, you sign people up in the hospital when they've had a baby and say, hey, let's talk about how to parent this child.
yeah.
Let's talk about what happens when it gets frustrating and you want to shake your baby. And we've all been frustrated with a crying baby before.
True.
But if you're 15 and you don't have a support system, you're likely not to make the same decisions that somebody that has a baby at 30 with a support system would make. And so it provides us a support system, but also somebody that goes in every week and says, well, okay, now let's talk about this. Now let's talk about why, even though your mama says it's okay to feed this 3-month-old some chicken, this is not a good idea, And
Right.
it's a little bit hard because it's saying maybe your mother or your grandmother might not have the latest and greatest medical idea, it's hard, but it's a really good program. And we have a lot of Parents as Teachers graduates that have their certificate on the wall, like, I'm a certified parent. I wish I'd had a book like that.
Yeah, it would be kind of nice, and probably my kids would probably be thankful if I'd have gotten that too, I
Mine
suppose.
would
But
too, yeah.
goodness gracious, you talk about your community partners. How important is that to have? I mean, and tell us who some of them are. I mean, y'all, because like I said, you're not doing it alone. You're hooked into a huge network of
Oh,
people.
no.
That are,
Well, I think our first community partner was obviously Delta Council.
yeah,
And when we started going into places, we didn't go anywhere without calling Delta Council and saying, we're going into Midnight, Mississippi, or we're going into Tutwiler, or we're going, because I wasn't from the Delta. And
yeah,
where, who do we talk to? Who is, as the term they use is the bell cow? Who's the bell cow in this town? Who can I go talk to? That will be helpful. So they have been the stalwart partner because they know the Delta so well, and they know everybody in the Delta and who might help. But the school districts are extremely important. Obviously, the doctors and nurses in every town are extremely important. The ministerial alliances are
yeah. I would think.
extremely important.
Yeah,
People in the Delta listen to their ministers. They listen to, they just listen to their ministers. And we have not only ministerial alliances, but a lot of the people that are our community health workers, or people that go home to home, or they're from their neighborhood. A lot of partners are retired school teachers. Are some of the most wonderful partners. Retired school teachers had everybody in class, and so they know everybody. They're great partners. I know I'm gonna leave some out. The health department. Dr. Rouza was in the Delta for so long, and we've missed him since he died. But I mean, he had a touch from the health department all across the Delta.
yeah,
And the health department still is a fabulous partner with tobacco cessation and those kinds of things. A lot of the businesses, the banks have helped us with work programs, with financial literacy, that type of thing. Been really good partners. I mean, we just have a lot of. I mean, the mayor in every town, the mayor's assistant in every town is
yeah. About
probably
to say
more.
that's where the power usually lies.
Yeah, really. I mean, the police departments have helped with, drug abuse programs. The
Mhm.
courts. I mean, I just can't even think of a person in some of these towns that's not considered a partner. I mean, we
Right.
we know just about everybody.
Well, that's the thing about Mississippi, and the 25 years I've been here, I've discovered that if people know you, they'll pay attention to you.
Yeah, I
Yeah.
mean, if
And
they
that's
know
a
you,
big thing of what you do. You just, people need to know and be able to trust you.
right. And the Delta Health Alliance is based in Stoneville, but we have offices in Clarksdale, Indianola, Vicksburg, um, where am I missing? Greenwood, Leland, where, I mean, just Cleveland,
Yeah.
Clarksdale. So we have people that work for us that are in all these different towns
Mhm.
and all these different offices. And then our home visitors are on the road all the time. So we're just not sitting in Stoneville in this office.
Right.
We're all over the Delta. And so that kind of helps because we're hiring people from all those communities. And so that helps us know more people too. And they know who the best partner is as well.
How many staff do you have now?
Um, it's over 500, but I lose
Wow.
count.
Yeah. Well, I mean, yeah, just ballpark's fine. So,
Yeah, and it's over 500. And then with this latest project we have with COVID, I think we have 293 now part-time people
oh,
across.
wow.
So it's gotten much bigger than I ever thought it would.
Yeah, no, but I mean, that's good. And like I said, the funding has been pretty consistent because you've now been through several, both state administrations and federal administrations in the
That
20 years.
that's correct. We're it's interesting. Delta Health Alliance is lucky, I think, in that both Republicans and Democrats have a reason to think Delta Health Alliance is doing a really good thing. So I think we speak to virtually everybody, and I think that's a good thing. So we haven't really had trouble based on administrations. Of course, we're very apolitical.
Yeah, and I remember even when Haley was governor, that was one of the things he talked about for Medicaid was making sure you had a doctor home, and then he wanted people to use the web because I remember doing a smart aleck cartoon about that, but as a spider web, not as in
Right.
because they didn't have the web, but still, I mean that's the thing. It's the things that y'all were promoting, and he was obviously a Republican, so that's on that. I love this quote from Sunflower County Supervisor Glenn Donald. I found this online. Said that you're one of the most respectable and compassionate people he has ever met, and he'd vote for you for president. So
Well, he is a sweetheart.
that's a very nice thing to say. I don't know. I wouldn't run for president personally, but if you ever
No,
do,
neither would I. But he's a county supervisor. He's also a minister, and we need those people. We need their
right?
support. We obviously have his, and I feel like if a lot of times we get new projects that we need to do by listening to those folks tell us
Yeah.
we not done, what are we not doing enough of, what's needed.
Well, speaking of what's needed, and I mean, obviously, like I said, I've been here for a quarter century now, and I've watched some things get better in the Delta, and I've seen some things stay the same. Obviously, the rural hospitals are under stress right now all across the state. That's an issue. And of course, Medicaid expansion is a political football, but it's out there. What are if you had your crystal ball out and you're looking at the next 20 years of the Delta and your mission and what the Delta Health Alliance is going to be doing, how do you see what you do evolving and what needs do you think will need to be met? That's a big question. Sorry.
um I think that uh, really what needs to evolve, it seems like to me, there's still a big workforce development issue in the Delta, because if you're going to create a new generation, like we've been here a generation, you're creating a new generation of people,
Yeah.
you're having people graduate high school more, you're having them, we've had a lot of success stories with people who have graduated first generation, have had some health issues, whatever.
Yeah.
We've got some videos we've taken off them that they're great success stories, but you want them to come back to the Delta. You want them to stay in Mississippi. You want them to then have a place to raise their children, a place to educate their children. And that's all about having people not leave, but stay and have a reason to stay.
Right.
And I think that as there are lots of programs and very good programs in the Delta to attract businesses more than just agriculture. You have to have the folks that can do that work, but you also have to have a good healthcare system.
Yeah.
And so like one of the projects that we've been doing lately is kind of a workforce development to make sure that we've got enough, CNAs, we've got enough, we've got enough people that can do early childhood education, that type of thing. Because in order to do more of what we're doing, we have to create more of those folks. We have to train more of those folks. And as you train them and they can do that work, then people are able to receive those services, and they're only really going to stay in the community if they can get those services. And so I think that's extremely important. It's kind of this circle, this poverty circle that we sort of say as a country or as a community or as a state, somebody's in poverty and they're not well educated, and you've got this problem. So what we're going to do is we're going to cut back on services because they're costing us a lot of money. And so we're going to cut back on these services. And then when we do that, then, somebody drops out of school or somebody becomes sick, or they maybe don't go to the doctor. And we really have to break that cycle, because then it just creates more of the same, as opposed to if you can educate that individual, if you can get that person to go to the doctor, then you kind of break that cycle.
Mm-hmm.
And people can then feel like they can come back to their community. And I think that's pretty important. You should go on the web. We videoed a young lady named Samisa Hoskins that went through the Indianola Promise community, ended up graduating from Gentry High School with, I believe, the highest ACT that Gentry's ever had, and got a full ride to Millsaps.
That's wonderful.
And she graduated from Millsaps and she came right back to the Delta.
I was going to ask, did she actually come back, and what's she doing now?
She is the executive director of a nonprofit in Greenville.
Okay.
Not come back and work for me, which upsets me. but we have some stories like that.
Yeah.
And we just need thousands of them as opposed to a handful of them.
Right. But it's planting seeds, though. I mean, like
it's planting seeds.
Yeah.
And if another student or another family or another child can see her,
she's a role model.
She's a role model, and students like her from Leland and from other places. If those can be role models, then maybe we'll, if I talk to you in 5 years, we may have hundreds instead of, a couple dozen,
Yeah. I mean, that's the thing. One thing, I mean, is for all the traveling I've done around the state, and I've spoken to a lot of kids, and per capita, I think we have some of those talented kids in the country in Mississippi. I mean, judge the Scholastic Arts Contest, and there's kids that are 13 years old that make me look like I draw with my teeth. They're just that good, but sometimes I don't think they have the hope. And maybe just because they haven't had that modeled for them in their life. And to be able to see somebody that looks like them, that's from their hometown or whatever the case, succeed, that's huge.
Yeah, I love all over our offices. I've got that. I don't know if you've seen those posters, Mississippi Believe It.
Yeah.
Mississippi creates some remarkable people, and it always has.
Yeah.
But people need to see that they could be one of those people too.
Well, and also too, that they can be one of those people here in Mississippi, and that they don't have to leave to do that.
They don't have to leave to do that. Yeah. And I always wanted to come back. I thought it was great that I was able to come back.
You were in Memphis. Come on now. That's not a huge,
Boy, it felt different.
What's that?
It did. It felt different. It really did.
I thought Memphis was the capital of Mississippi. Wait a minute. So
that's what people say, but coming from Memphis to the Delta was, it was different.
What did draw you back?
This is home. You just want to go home. You just want to go home and make some kind of difference.
Yeah.
That's sort of always been there, I think.
And you've got the data now to show that you've been able to do that.
Yes, definitely the data. Definitely the data. But we also have the data that says we have a long way to go.
I'm about to say, like I said, Mississippi, I can say nothing but nice things about the place, but I understand the frustrations on a daily basis too. And I know there's days when you probably come in there and you're like, beating your head against your desk. Okay.
It gets frustrating at times. It does. But you also, you see these wins,
Yeah.
and it just you think, okay, all we've got to do is multiply that, and it really makes you feel good. I mean, we opened up a health center in the middle of COVID in
Yeah.
Leland, and we have, I think, 315 or more people that have joined our health center, and people thought we were crazy. Um,
Speaking of COVID, I just, I've been so focused on what's going on at UMMC with the parking garages being converted into field hospitals, and the Delta numbers are all off the charts and everything. How is the Delta being affected by Delta?
well, actually, if you look at the state of Mississippi charts, the Delta is now the most vaccinated area
Yeah.
in the state of Mississippi. Um, I think it's affecting everybody the same as it's affecting them in Jackson. I mean, the hospitals are full and people are
Sure.
sick, but the Delta has responded. I mean, I don't know if you're aware of this, but we have a big vaccination project
Yeah.
across the state of Mississippi, and I originally wanted to do it for the Delta when I applied, and I got a call and said, we really need to just do this all over the state.
Wow. Yeah.
And the reason was because of our outreach, our home visitation. Um, and so we're doing that project across the state of Mississippi right now, which has been a new experience for me and a thrill to be able to do it. Um, but I think the Delta has responded, and a lot of that is because the Delta's, you know, what I find unique about the Delta is most people don't say I'm from Greenville or I'm from Leland or I'm from Clarkston. They say I'm from the Delta.
Right.
And most places in Mississippi don't do that. I mean, they do feel sort of united in that front and have really, I think, responded in a remarkable way and gotten vaccinated in droves, which is, of course, made me very happy.
Yeah, I was on a panel yesterday with Dr. Dobbs, and he was talking about how African Americans in the state have got the highest percentage of people that are vaccinated right now, which makes a lot of sense considering initially when this thing began, they were clobbered. I mean, they were hit hard.
They were
African Americans were, yeah,
and they were clobbered, but they've really come together. I told you there's 293 people that we have that are part-time workers
yeah,
are in all 82 counties,
okay,
running around the state of Mississippi, going to ballparks, going to museums, going to schools, going to
oh wow,
churches, going to everywhere, trying to talk to people about the need to get vaccinated. And I mean, our goal is not to put a shot in an arm, but it's to get somebody to that point.
right,
The grant started July 15th. We had, I think we've seen about 15% across the state of Mississippi jump since that project began.
that's great.
And we've had thousands upon thousands of conversations, individual conversations with Mississippians and groups, everything from Rotary clubs to Sunday schools.
Hmm.
And I think that's been helpful. And it's let me know that what we're trying to do at Delta Health Alliance can be done other places. People say, oh, the Delta's different, and it is. I mean, there's no doubt, but it can be done in other places, and it's been quite an experience to do it across the state of Mississippi. We've had people like Archie Manning and Jerry Rice. I know you've probably seen the
I saw
commercial.
the commercials. I was going to say, how did you get Archie in on it? And he did a great job, by the way. So he may have a future, in show business.
we
His kids seem to be doing pretty well at it.
we asked him
Yeah.
and said, I mean, he's from Drew. He said, if I could do something to help, I mean, he just immediately said yes. And Jerry Rice the same way. It didn't take him 2 seconds to say, oh,
There he is right there.
no, I'm so sorry.
No,
It
that's
didn't
okay.
take him 2 seconds to say yes. And we just released one Monday of the Mississippi Mass Choir,
Oh, that's cool.
and they are fabulous. They are absolutely fabulous, and we're getting a lot of good responses. And we're that's just one of the many different facets we're trying to hit people. I mean, I know the home visitation has always worked for us, going to people one-on-one, go into groups, but social media, radio, television. I mean, we're just trying to hit this in so many different ways.
I know. Speaking of social media, you think about it, when y'all got started, social media didn't exist.
Not really, no.
Yeah.
I mean, and our website is deltahealthalliance.org. Had we been really up on social media, it would have been much shorter than somebody had to type in Delta Health Alliance. But it was really pretty new. So yes, we've had to grow along with social media because we didn't have that. Well, and the people that we were trying to serve really weren't in on it because they didn't have a lot of phones
Right.
or computers or all
Didn't have a Twitter account. Yeah.
Didn't have a Twitter account, all of that kind of thing.
Which, if they didn't, they were wise. It probably would. Speaking of mental health, but you talk about, and like I said, I'm very fascinated. Just going back to the panel I was on yesterday, I was talking about building trust and how to get the message out and everything else. And at the end of the day, I think their conclusion was that your local doctor is the best source of information. Usually probably what you're getting off Facebook probably isn't, but but it all boils down to trust, and you're managing to reach people that don't have a doctor. And that was kind of what I was wondering yesterday, is like, well, how do you get to the people that don't have a doctor? And it sounds like y'all kind of figuring that out.
Well, we've divided the state into sort of these little quadrants and have leadership in different sections of the state, but we're hiring people from all over each county that know people in that county, and that have some trust in that county, have built a relationship over their lifetime in that county. And so we're asking those people to deliver the message, because they're not going to listen to you or me or probably Dr. Dobbs, but they might listen to the person that goes to church with them or lives down the street from them, or
their preacher or
that kind of thing. And so we've hired many people in those counties to go out and deliver this message. And I'll have to send you a T-shirt. It says Mississippi, take your best shot.
Nice.
And so hopefully and we've got little "I've been vaccinated" stickers of the state on it. I mean, hopefully to get people excited about this, and it's been reasonably successful. I don't think I'll be happy until we have much more of the state vaccinated, but we're not 50th anymore. We are 47th.
Oh, nice. I know that during the Delta surge that it really did literally move the needle, so.
Right.
Yeah. Sorry.
And that's when this kind of started. Yeah.
Yeah, definitely. Well, Karen, like I said, I promised you I wouldn't keep you too long. Is there anything that I have not touched on that you'd like to either brag about or talk about or mentioned or give a passing glance?
No, I'm just thrilled that you wanted to talk to me. Thrilled that somebody's interested in what Delta Health Alliance is doing. We're proud of it. We really like to be sort of a people. It's interesting. In Stoneville, when I first got there, I saw people from all over, not just the country, but the world, that would come into Stoneville like, what's wrong with this plant? Can you fit, because there are just a lot of researchers all over. And I've always been hopeful that people, hopefully in Mississippi and maybe even further, could look at Delta Health Alliance and the data we've collected and say, maybe this is how to help rural America a little bit more. Maybe this is a good model of how to help rural America, because that's what we really care about.
I mean, like I said, I'm going to butcher this, but when they say health is wealth, and I think there's a lot of truth to that. Obviously, if Mississippi wants to excel in other areas, we have to get ourselves healthy. And
correct.
It sounds like y'all are kind of working your way toward that.
We're hoping to, yes.
Yeah.
We are.
No, hoping to. You're going to. Come on now, let's be positive. So anyway, thank you so much for spending the time with me today. This has been really fun.
Well, thank you, Marshall. I appreciate it. Thank you.
All right. Take care.
Okay. Bye-bye.
Thank you for watching this episode of Mississippi Stories. Make sure to subscribe to the Mississippi Today YouTube channel and click the bell to be notified every time a new video uploads.